Good morning everyone, I'm Yasmeen and today I will be presenting on pandemic disease, lesson from COVID-19 and future preparedness. We've all lived through COVID-19, but beyond the headlines and statistics, there are deeper biological concepts and real-world lessons worth unpacking. So let's begin by looking at how this pandemic was not just a health crisis, but also a challenge that reshaped societies, economies and even the way science works. COVID-19 was not just a health crisis. It was a global challenge that reshaped societies, economies, and scientific collaboration. By understanding the biological concept behind pandemics and learning from the experience, we can strengthen preparedness for the future. So, how did a tiny virus manage to change the entire world in just a few months? Let's break it down. Pandemic diseases occur when infectious agents such as viruses spread globally. COVID-19 was caused by SARS-CoV-2, an RNA virus from the coronavirus family. Its spread highlights several key biological concepts. First, transmission occurred mainly through droplets and aerosols, showing the importance of airborne control measures such as masks and ventilation. Second, mutation in the spike protein produced variants like Delta and Omicron. This mutation increased transmissibility, altered severity, and reduced vaccine effectiveness, proving how small genetic change can have massive global consequences. Third, immunity from both infection and vaccination wanes over time. This decline in protective antibodies explains the need for booster campaign. Finally, the zoonotic origin of COVID-19 illustrates how pathogen can cross from animals to humans, reinforcing the One Health principle that human health is inseparable from animal and environmental health. But science is not just a theory. What happens when this concept collide with the real world? These biological concepts directly shape global responses. Since COVID-19 spread through the air, government enforced mask wearing, social distancing, and also lockdowns. The breakthrough of mRNA vaccines demonstrate how science could adapt rapidly to viral mutations, saving millions of lives. Genomic surveillance allowed real-time tracking of emerging variants, guiding policy and vaccine updates. However, the pandemic also revealed vulnerabilities. Waning immunity made booster shot critical, but many populations delayed uptake. Overwhelmed hospitals exposed limited ICU capacity, shortage of medical supplies, and lack of trained staff. Beyond healthcare, prolonged lockdowns caused economic recession, disrupted education, and strained mental health, showing how biological principles translate into real-world social outcomes. Let's zoom in on some real stories, numbers, and outcomes from around the globe. Countries adopted different strategies with varied outcomes. New Zealand's strict border controls and early nationwide lockdowns kept deaths relatively low. This approach was effective for an island nation but may not be scalable to larger, highly connected countries. In contrast, Malaysia faced multiple surges with more than 36,000 deaths reported by 2022. Limited ICU capacity during the Delta wave overwhelmed hospitals, but an accelerated vaccination program later reduced mortality and severity of infections. India experienced one of the deadliest Delta waves in 2021, with oxygen shortage highlighting gaps in preparedness. Meanwhile, the United States faced widespread vaccine hesitancy, which limited the effectiveness of its early vaccine rollout. Globally, the WHO reported over 7,700 million confirmed cases and nearly 7 million deaths by 2023. On the positive side, the rapid development of mRNA vaccines was a scientific milestone. Yet, unequal vaccine distribution exposed global inequities. Low-income countries struggled to access those long after high-income countries had rolled out booster programs. So, with all these numbers and lessons in front of us, the big question is, how do we make sure the next pandemic doesn't hit us this hard? From COVID-19, several lessons stand out. We need stronger early warning systems, especially genomic surveillance, to detect new pathogens quickly. Global collaboration must ensure equitable access to vaccines and treatments so that no country is left behind. Transparent and science-based communication is essential to combat misinformation and boost public trust. Health systems must expand their surge capacity in hospitals, supplies, and trained personnel to withstand future crises. Finally, adopting a One Health approach that monitors animals and ecosystems can reduce the risk of future zoonotic outbreaks. In short, the past was a wake-up call. The real question is, are we ready for what's next? Picture this, it's 2035. Another strange virus tries to spread across the globe. But instead of chaos, we see rapid response teams, strong hospitals, fair vaccine access, and trust in science. That future isn't fantasy, it's possible if you start preparing today, because the only thing scarier than COVID-19 is not learning from it. You don't wait for flames before practicing a fire drill. Same with pandemics. The time to prepare is now, not when the smoke alarm's already screaming. In conclusion, COVID-19 has shown us how fragile yet interconnected our world truly is. But it has also proven the power of science, collaboration, and preparedness. The lessons we have learned must not be forgotten, because the next pandemic is not a question of if, but when. With stronger systems, trust in science, and global cooperation, we can face the future with confidence. That's all from me. Thank you for your time and attention. I'm Yasmeen, and it's been my pleasure to share this with you guys today.